Hello, everybody, and welcome to KP's Candid Conversations, a chance for us to pick the brains of KP's best and brightest. Today's conversation, a little more personal, only because I thought I knew everything that I needed to know about COVID. Of course, working in communications for a healthcare organization like Kaiser Permanente, you really got to be well-versed on all things COVID. That was until just a few weeks ago when I actually got COVID. I had made it 2.5 years through this pandemic, getting vaccinated, boosted, wearing masks, and I didn't get it. And I thought for sure, I am not going to get this. I can beat this. And of course, just a few weeks ago with this new highly contagious variant, the Omicron BA.5 variant, I got hit. I got bit by the coronavirus bug. And of course, I felt like a kid again of not knowing anything. How do I test? How often do I test? Should I call the doctor? So we talked it over and we thought, this is a great opportunity to do a little COVID 101. So joining me today is Dr. David Bronstein, pediatrician in the Antelope Valley. Dr. Bronstein has given us so much information about COVID throughout the entire pandemic. So he's a perfect person to talk to about this. So, Dr. Bronstein, I assume there are a lot of people that are in my boat that made it the 2.5 years of this pandemic and now are finding themselves sniffling, sneezing, and coughing.
Definitely. It really seems like recently we've been hit very hard with a lot of first timers, people who survived the original wave, people who survived and never got hit with Delta, and people who didn't get hit with Omicron during that big winter surge. And I think after that, once we started seeing one of the Omicron subvariants, the BA.2, and now, of course, with BA.5, which is even more and more transmissible, the virus seems to be picking off people who, up until now, have really been able to avoid it. So it's happening. We're seeing it in a number of friends of mine and physicians who are being very, very careful in their daily lives. And like you said, have gotten the vaccines and are wearing the mask as much as they possibly can. There's just so much virus out there and it's just so transmissible that it's really getting those last few folks who just haven't been sick yet.
So, Dr. Bernstein, it seems like we have a large, we have this huge surge right now of COVID cases, but relatively low hospitalizations. And things are staying relatively manageable at the hospital level.
So in the beginning, there was the original the original COVID or coronavirus, SARS-CoV-2 virus to be exact. And then it started mutating, and you would see some relatively subtle mutations sometimes of that spike protein. And that's really how we categorize each of these variants, is based on what that spike protein looks like. And so we had the alpha strain. The next major one to hit us in the U.S. at least was the Delta strain, even though there were some other variants in between. But Alpha, then Delta, and then the next significant change to the variant was when we got the Omicron. Now, each of the Omicrons that we're seeing, we haven't seen anything new since Omicron in terms of a new variant, but we are seeing new subvariants. So it's more minor changes. It still can be overall classified as the same variant, but it's different enough where it's its own subvariant. And clinically, it behaves as though it is pretty much a new variant every time you see one of the BA.2, BA.5s, any of those. Now, people don't seem to be getting as sick, and part of it is because the new subvariants that we're seeing of Omicron, even though they're more transmissible, they're not necessarily more severe, and they really don't appear to be so. So part of it is because the subvariant itself isn't more severe, isn't like, if you remember how severe Delta was back in the day, we're not seeing anything on par with that anymore. Part of it too, though, is because of the people that are being infected, the fact that we have immunity now from a number of different sources. It can be immunity from the vaccines, plus the booster, plus a second booster in cases where that's indicated. It can be immunity from having had the infection before, or it can be a combination, that hybrid immunity that we talk about, where people are very, very protected against severe disease because they have so many good antibodies, such a good immune response from having been infected before, plus having that additional protection from the vaccine and the boosters. So people inherently are lower risk than they were before, but it doesn't mean that people still can't get sick. And unfortunately, because so many people are getting COVID now, yet again, because of the increased transmissibility of the subvariant, with higher numbers of infections, higher the likelihood that people will have some severe cases or wind up in the hospital when you look at the numbers overall. Another reason why we're seeing um, people who are protected from hospitalization and the lower rates of hospitalization despite the increasing number of cases is we do have good treatments available right now. And more and more, we've been able to get those treatments to people who need them at the time when they need them. So, for anyone who's high risk, who has a high risk medical condition, who's really over the age of 12, they're eligible to get the oral medication, Paxlovid, which does work well in terms of preventing hospitalization, preventing severe infections, preventing death. And so that's something that we've been able to get to people as long as they get it within that first 5 days or so. It really gives them very good protection against worse and worse outcomes from COVID.
So you mentioned Paxlovid or Paxlovid, not sure how you say it,
I've heard it both ways.
and of course from Desivir. What do I have to show up at your medical clinic at a hospital? What kind of symptoms do I have to show up with to get prescribed these medications?
So, first of all, we don't want someone who's too sick to be treated as an outpatient. It's not helpful when someone's sick enough to be hospitalized. So, we don't want to give it to someone who needs to be in the hospital. That's a whole other set of treatments that we've also gotten better at, which is good. Instead, it's someone who really doesn't have severe symptoms yet, who is safe to be treated as an outpatient. But it's not for everybody. For someone who's healthy, who doesn't have any underlying medical conditions, it doesn't make sense to give them Paxlovid. It's not going to, it hasn't been shown to help in the studies in those individuals. And in some cases, you hear about that Paxlovid rebound, which is where you take the medication potentially too early, or maybe the 5 day course isn't as long as it potentially should be, and you wind up with people who feel better right away, test negative right away, and then all of a sudden, a few days later, they come down with an even worse case of COVID and start testing positive again. And in that case, maybe need retreatment or maybe not. It depends on how they're doing. But it can actually potentially prolong the illness there. So we don't use it for everybody. Plus, these are pretty strong antiviral medications and medications that can have side effects and medications that can interfere with a whole lot of other medications that people may be on. So we always think critically, is this someone who's high risk, not just of getting COVID, but of getting COVID complications? In which case, this can be a life-saving and is a life-saving medication to keep those folks out of the hospital, knowing that because of their underlying risk factors, they otherwise would wind up in the hospital and have potentially really bad things happen to them.
So we're in this weird testing phase, right, where we get these symptoms, and I will tell you that the COVID, when I got COVID, my symptoms were relatively mild. It felt like a cold. It felt like a bad cold. I mean, I didn't enjoy the experience at all, but it wasn't anything, terrible. I tested positive right away. I mean, and we're talking, I definitely had the two dark lines. And then, of course, my wife and my daughter got it as well. And I reported my positive test to KP, but my daughter and wife knew they also had COVID. They tested positive. They were having the same symptoms. They didn't report that test. Should we be telling our physicians and our care team about positive tests?
Right. Ideally, go on kp.org and let us know that you have it. It's an important part of your medical history, of your medical record. It does change things in terms of thinking about things like timing for when would be the perfect time, for example, to get a booster shot or things like that. It's nice to know if you've had a recent infection or not. It also matters in terms of the amount of time that you should be isolated, and potentially maybe we should reschedule some other appointments if you've had COVID very recently. We don't want you to come in and potentially infect other people. Now, I know your family, you're responsible, you're not going to put people at risk, but I think for others out there who may not even know how long do I need to isolate, for example, it's useful to let us know that information and have that as part of your integrated medical history. So that's always helpful. Now, the issue with the tests at home, I mean, I think it's great. I think it's tremendously convenient. I think it's great. I personally had a cold a week or two ago, and I wanted to know, is it COVID? So I was able to test myself really for a few days straight just to make sure that it wasn't that. I didn't need to drive to, a clinic or a testing site. I didn't need to wait a few days to know if I had COVID or if I had something else. I can do it immediately. And within really about 10 minutes, I knew that it wasn't COVID. Still didn't mean that I shouldn't be careful and shouldn't expose other people to that cold, because any cold right now, whether it's a common respiratory cold, a flu type virus, any of those kinds of things can really, make people miserable. I mean, not only do you feel bad, but it changes. Can you go to work? Do you want to be around other people? Do you want to do all those things that you enjoy doing? It's great to not be sick for any reason right now, and we all need to do our part not to expose others to that. But having that test at home is tremendously convenient, and I hope that most people have taken advantage of getting those tests to have in the home setting, either from, I know you can get it from the government, you can get it from our KP pharmacies. It's real easy to get a hold of these tests for free these days, and it's good to have those on hand for whenever you need it.
And tell me this: when should I actually go into a clinic, go to a hospital, and get a test? When I can do it at home, but when should I go actually get one at a clinic and get a PCR?
So there's really less and less usefulness of the PCR test, to be honest with you. It's a great test. It's a very sensitive test. So it's going to detect even if you don't have any symptoms. But if you've been exposed and it's been a few days after that exposure and you really want to know, I had a real legitimate exposure with someone who tested positive. Am I going to get it? Do I have it and just not know it yet? It's a lot more likely to be positive in that scenario than the home test would be, the home self-antigen test. So it's very useful for an exposure situation. Doesn't mean 100% that you have it or don't have it, especially if it's negative. You may have tested too early. Remember, there's still a fairly long incubation period from the time that you're exposed to the time that you start testing positive or start developing symptoms. That could be several days, beyond a week in some cases. So if you test 2 days after an exposure and it's negative, it doesn't mean on day 3, 4, 5, 6, 7, for example, you won't then become positive. But it is a good indication if you do test kind of in that 3 to 5 day window and it's negative. More than likely, if you don't start developing symptoms, you're probably going to be out of the woods. So the PCR test is very useful for that versus the home antigen test. That test is very good at determining if you have symptoms, are those symptoms due to COVID or not? So again, going back to my cold, I had symptoms. I had a runny nose, I had a cough, I had congestion. I really felt pretty crappy, but I wanted to know, is it due to COVID? Once you have those kinds of pretty decent symptoms and you go ahead and swab your nose and you get some good snot on there and you really do the test, if that's negative, that's a pretty good sign that your symptoms are not due to COVID. Okay, and so that made me comfortable doing just a few of those tests, knowing that it wasn't COVID. Now, on day 1, when I just had a little bit of a scratchy throat and I did that test and it was negative, I didn't know if I should believe it or not, because at that point you don't have enough of those antigens that the test is looking for, basically the proteins from the virus, to know to really be detectable by the test. So if you do the test too early, especially with that antigen test, you're just not going to know if it's really an accurate result or not. But by the time you've got full-blown symptoms and you do that test, it should be fairly accurate. And there's really no reason to confirm that test with a PCR test. A time where it would be helpful to confirm with the PCR is if you were using your home antigen test because you were exposed and just wanted to know if I've got COVID, an early indicator, doing that antigen test, in which case it's probably less likely to be positive anyway, because it's probably too early. Well, if that's negative and then you say, well, I really want to make sure, that's where the PCR test can be helpful in that case.
And of course, KP now does have that capacity to handle more people coming and getting their PCR tests.
Oh yeah, no, we've got the ability to do many, many more tests than we are doing right now. Back in the day when there were no home antigen tests, We reached our capacity, unfortunately, pretty quickly. We even built a whole new giant laboratory in order to handle that volume. Now, so much of that is not necessary because you can test at home for almost anything that you need the test for. The one caveat I would say about the home test is make sure you do it correctly and make sure you interpret it correctly. There were actually some studies showing, different tests and asking people if they thought it was positive or negative based on these pictures. And you would be surprised, even people who were trained in how to read these tests, they were often getting it wrong. In terms of if it's even a thin line, a very faint line, that's still a positive. Or making sure that the test is valid, that you have the correct control line there to show that the test is valid. It's going to pick it up if it's there. And then looking at the testing line, it doesn't matter if it's even just faint, even if you think you're just hallucinating a line, that is still a positive test.
So funny you should mention. So I tested positive right after those first symptoms, and as I said, very dark lines on my test.
Yeah.
And on day 6, I started to see the line fade a little bit, and it was like every day. It was like I was going in, like doing the test and thinking, okay, this is the day it's going to go away, and it just didn't. It didn't go away until day 9, and finally, there was no line there, but there was a faint line every single time. I'm assuming that every time I see that faint line, even just a little bit, and I would put the spotlight on it, I still have COVID at that point, or I still have the potential to spread it.
Exactly, exactly. If it's positive, it's positive. If it's negative, it's negative. There's really nothing in between, to be honest with you. And I really don't want people going out there saying, oh, I've just got a mild case of COVID because the line is a little bit faint. It doesn't really work that way. A lot of it depends on how good of a swab did you do, how much sample was on there, for example. So a lot of things can factor into how dark the line is. We're really not supposed to make any assumptions based on that. It's just think of it as a yes or no, like a pregnancy test. Either you're pregnant or you're not. Either you have COVID or you don't. It's not going to tell you, "Ooh, I'm almost done with COVID because the line is a little bit fainter today." So I really don't want people to interpret it that way. I know one question is, when to use the test to clear yourself from isolation, and you bring up that point about testing through day 9, for example. If it was me, I would have said, why bother testing on day 9? You're going to stay in isolation till day 10. There's no reason to test after that. So just assume it's fine at that point. Okay. But the testing, the home antigen test, can be very helpful if you want to clear isolation early. So if rather than waiting the full 10 days, for example, if you were sick with COVID and you're sick going into, day 5 or so, but you're feeling a lot better, your fever's gone, the symptoms have improved, you're back to normal, or if you tested initially on, day 0 and you really didn't have symptoms, but you were exposed and you were positive then on day 5 or beyond, it is okay to test at that point. And if that antigen test is negative, then you can clear yourself from isolation. Okay, you still want to wear the mask for the full 10 days of being sick, but it is okay to be going back out in public. Different workplaces, though, however, may have different rules about that. So don't take this as gospel here. You want to check with your employer or your kids' schools, for example, in the future here, and make sure that they have that same policy about clearing isolation earlier by day 5 with a negative test. Most places are doing it that way now. Now, having said that, if you keep testing positive on, day 6, day 7, day 8, the recommendation is just do the full 10-day isolation. Now, there's no need to test on day 10. And I know that confuses a lot of people, and they think I want to test and show a negative test before I remove myself from isolation and go back into the world. That's not necessary. And in fact, sometimes that antigen test stays positive. What we know is clinically, it doesn't really mean anything because maybe there's still some fragments of proteins around that are still triggering the test, but it would be really, really unusual based on everything that we've learned over the past few years here. It would be really unusual to still be contagious by day 10 of the illness. And usually, probably around day 7 or so, people are no longer contagious, even if they still have some symptoms. But really, by day 10, you're done. And so I know a lot of people are testing on day 10 thinking, oh, I got to get a negative test before I can, get out of my house. That's not the case. Day 10, it's assumed you're done with isolation. Now, that's for the home antigen test. For the PCR test, once you have a positive PCR test, stop doing PCR tests, okay? Because that test theoretically can remain positive for months afterwards. So if you test positive on PCR, the one that you drive to our clinic and we do it for you, that test is probably going to stay positive for several weeks, if not months afterwards. And so that's not a helpful test, definitely not a helpful test to clear someone from isolation on day 5, for example. But even at the end, or even if you come down with a cold the next month and you think, oh no, did I get COVID again back to back, which would be really unusual, doing a PCR test, if that's positive, it has nothing to do with whether or not your more recent infection is COVID. It just tells you had COVID a month ago, but nothing more than that.
Could I have lingering symptoms even though I'm testing negative?
Absolutely. You can definitely have some lingering symptoms, and hopefully that's all it is. Lingering symptoms is normal after any cold, even the cold I just had, which wasn't COVID. I still feel a little bit stuffy and a little bit of cough here and there. That can happen with any respiratory illness, even for a few weeks afterwards. You may still have a little bit of difficulty breathing, a little bit of the cough, for example, even some congestion or postnasal drip. These things can happen for quite a while afterwards. The thing we're, of course, all scared about is long COVID. And that's where either you have the COVID, the classic COVID that just isn't getting better after a while. Even once you start testing negative, you still may have these symptoms that go on for extended periods of time, or any of the other complications you hear about with long COVID, which would be, of course, brain fog or extended periods of loss of taste and smell, for example. But really anything, any organ system could be affected by long COVID from everything that we've seen and learned so far. So that would be more concerning. But if it's just ongoing, just mild respiratory symptoms, I wouldn't be too concerned about that as long as it's getting progressively better over time and you're moving the right direction. Nothing I'd be worried about.
And and doctor, tell me this: when do I need to call you? When do I need to go in? When is it serious enough that I should be going into a hospital and getting care? I mean, I kind of took care of this by myself because they were minor cold type symptoms. But when should I actually make that next step?
Yeah, really, if it's behaving like more than a typical cold for you. And so definitely if you're having any difficulty breathing, that's the big one. That's, early on from the beginning of COVID and even to this day, that's why we hospitalize people when they have trouble breathing or if their oxygen levels are getting too low, which of course you want to know unless you check it, or if you're having that trouble breathing. Okay, so any of those respiratory issues where it just feels like, having trouble catching your breath or breathing more rapidly than usual, anything like that, gasping for air, that's where you really need to seek help because you very well may need oxygen or other supportive type care, which we would typically do primarily in a hospital setting.
So, what's the state of vaccines? I know KP will soon be getting into our flu mode, where we're going to start pushing for people to get their flu vaccines. Is there a combo flu coronavirus vaccine? What's the state of vaccines?
So this year, there's no plan for a flu and coronavirus vaccine. Although in the future, it sure wouldn't surprise me. Although who knows with COVID what it's going to turn into by the time that's available. But right now, no plan to combine them. But it is totally fine and it's recommended get them both together. So if you're coming in the fall for your flu vaccine, which we will have available starting even as early as August, but definitely by September, October, come in for your flu vaccine. Uh, you can get your flu vaccine and your COVID vaccine or your COVID booster, whichever part of the COVID spectrum you're on, you can get that at the same time as your flu vaccine or any other vaccines.
So interesting. So getting the two vaccines together, getting a flu vaccine shot and getting a COVID vaccine shot, aren't going to make the two worse, right? It's not going to make me feel any worse than I would if I just got the one shot.
No, and there were actually just studies that came out, I believe, earlier this week, just showing exactly what you're saying, that the two don't seem to have that additive type of effect of, one making the other symptoms or side effects worse. It's not the case. So So yeah, no reason not to get them together at the same time. And just remember, I know some people think, it's not just about side effects from both. Although honestly, for flu vaccine, the side effects are pretty mild, especially compared to the COVID vaccine. But people think, can my body handle it? Can I make antibodies against the flu at the same time I'm making antibodies against COVID? And the answer is absolutely yes. I mean, we make antibodies all the time. When I see kids for their 1 year visit, for example, I'll give them 5, 6, or 7 vaccines in some cases at the same time, and their little bodies are able to totally handle it and still make antibodies to the foods they're eating and whatever's in the air and whatever's coming out of my mouth at the time. These are things that our bodies are made to do. So don't feel like you're overwhelming your immune system by giving more than one vaccine at the same time. So for the older folks out there, you can get the Pneumovax vaccine at the same time, for example. Great idea going into wintertime if you're not up to date on that as well. So with regard to COVID vaccines, by fall, we are expecting to see an Omicron specific vaccine. It looks like it'll be the original vaccine plus an Omicron specific variant in there as well in order to give you protection. Now, unfortunately, Omicron has changed so much since the original Omicron that these vaccines were based on. And so it's not going to have, for example, the BA.5 or the BA.4 or the BA.2.1, 2.1. It won't have any of those. It'll just have original Omicron in there. But that will still give you some good cross immunity is the hope and the thought there. So what I would say, though, based on how much COVID is still going on right now, I really don't want people to get the understanding that you should wait for the fall vaccine if you're due for a vaccine right now. Okay, because we're in the middle of another surge right now, to be honest with you, the BA.5. And to not have the protection of any booster right now, which is still going to go a very long way to give you some good protection, doesn't make sense. So if you're due for your first booster, get your booster now. If you're due for your second booster and you're over the age of 50, or if you have moderate or severely immunocompromising conditions, get your second booster right now. That's recommended if it's been the correct time frame. So these are things, don't wait for the fall in order to protect yourself against COVID. But there probably will be some new shiny vaccines in the fall for boosters, and we'll see what those recommendations are, who it's for. Is it just for seniors, for example? Is it for everybody? Is it what the time period in between your last booster and this booster? Lots of recommendations, lots of FDA and CDC decisions to come, but definitely will be a good idea, especially in the fall when kids are going back to school. People have traveled all summer and swapped God knows what. So definitely a good time to get those vaccines. With regard to flu, we are expecting a nasty flu season this year. Okay? I know we've fared the last 2 years. The first year of COVID, we didn't even have a flu season. I don't know why. I know people say, well, we were all wearing a mask. Well, it didn't stop us from having multiple COVID surges and other viruses going around. It was just one of those anomalies where flu just decided not to show up that year, or maybe COVID crowded it out. Last year, we had a very strange flu season. So we had basically not much in December, January, February when we typically have flu. And then all of a sudden, starting in around April or May, we had this weird springtime influenza, and those numbers went higher than the numbers we saw in the wintertime. So it was an off-season flu year. Nothing that we've really seen in recent history. So that was very unusual. Fortunately, the cases didn't go crazy out of control. But there were a decent number of people coming in saying, hey, I think I've got COVID, and they turned out to have the flu instead. This year, though, we're bracing ourselves because this is an awful flu season in Australia. We always look at the southern hemisphere at their winter, which is right now, as a preview to what's going to happen in the US. And sure enough, in Australia this year, they've got their twindemic, flurona, whatever you want to call it, where they've got flu and COVID in record numbers at the same time. And people are getting very sick. And in some cases, they're saying the flu is worse than the COVID this year. So definitely this is a good year to not sleep on the flu shot. I know a lot of people have missed it the last 2 years, and they've been lucky that, again, flu didn't cause much damage. but this year is going to be entirely different. So I really want to encourage everybody to get not just their COVID boosters, tremendously important too, but to get the flu vaccine as well.
Great words of advice. Thank you so much, Dr. Bronstein. And one final time, I should not feel guilty that I got COVID, because I just felt incredibly guilty.
No, it's inevitable. I mean, it really is. I mean, it I don't ever want anyone to feel guilty about that, for sure. Especially if you've been doing everything you can to protect yourselves and protect the people you care about, definitely don't feel guilty. I've known so many people, like I said, these are physicians, these are other folks. I've seen it go through department, one person at a time, and it's people are getting it now despite taking the best precautions. And even with regard to the precautions, I get it. It's people are letting their guard down right now, and it makes sense, right? If you've got the vaccine and the booster and a second booster, take your chances. And I understand that. I personally am not going to take that chance. I'm not going to not wear my mask if I'm in a high risk situation, because I worry about long COVID. I'm not worried about COVID putting me in the hospital or killing me. I mean, it definitely shouldn't do that based on the fact that I've got all the underlying immunity from the vaccine and the booster. But even with the vaccine and the booster, if you come down with a case of COVID, you just don't know if it can become long COVID. More than likely it won't. And that's where, again, the vaccine and the booster seems to give very good protection against that. However, you just never know. And I don't want to take that chance in a profession where I probably shouldn't be going to work with brain fog. I really need to make sure that I'm doing everything I can to protect myself as well as those around me. But I get it when people are going back in society and not wanting to wear the mask, and I understand that, but just not a choice that I'm personally willing to make.
Dr. Bronstein, thank you so much for your time. Truly appreciate you taking time out of your busy schedule. You're such a treasure trove of great information for us, and you have been throughout the pandemic. I appreciate your time.